one new addition to the practice this year that's working really well is using CBD and CBG products to help the patients get off of their pain medication. As you know, we have an opiate epidemic in our United States and really worldwide. And so we're all trying to do our part to limit that by prescribing less, being smarter with the way we prescribe, and using interventional procedures and other things to try to keep people from the need for narcotics in the first place. But one thing that's been good for our patients that are trying to get off their medication is giving them a substitute. You know, when you want somebody to quit smoking, you don't just tell them stop and you'll be fine. You give them Chantix, or you give them Nicorette gum, or you do something to give them a way to help get over their problem that they're struggling with and their addiction in many cases. And so what we're trying to do here is offer people a natural treatment that will help them. And so for years we've been hearing about CBD and what is CBD and what does it do. CBD is going to be talked about in just a minute, but what I want to talk about also is CBG and the way that these two work together, called the entourage effect. And what I mean by that is these together are better than one alone. So what we're offering is they can buy them individually as a CBD, or they can get the CBD and the CBG pack called the system. Why is that important? Well, the way our bodies are made, we have different anandamides in our body, which are naturally occurring hormones which cause different reactions. So, for instance, people talk about the runner's high all the time. The runner's high is actually anandamide. It's an endogenous body hormone that gets elevated by running or yoga or some kind of physical activity. And so you know people like that. If you don't let them work out, they get real angry and they get, they're hard to deal with and things. So what we found is that CBD activates that hormone. And so what it does is it helps people with their mood, with maybe anxiety, and maybe other things such as depression and other things of that nature. Some people with post-traumatic stress disorders and other psychologic problems. So we're seeing that pretty much across the board. But there's also patients that have a lot of peripheral problems, especially in my practice. They're pain patients, right? And so CBG was introduced by a company called Zalise, and what that does is it has different effects. And so the reason it has different effects is it has different receptors in the body. We're talking about the GI tract, we're talking about the immune cells, we're talking about macrophages that fight disease, we're talking about several different things. And so what the patients that are taking the CBG are getting is they're finding they're getting some pain relief, they're getting some muscle relaxation, they're getting a better chance of having sleep improvement. They're also seeing all other kinds of effects that we're expecting with anti-inflammatory medications. So the combination of CBD and CBG, that entourage effect, the two better than one, are making a big difference. There was recently a study that came out that showed that there's a chance that the two together will actually decrease oxidative stress on cells. Each of them individually doesn't necessarily, but the two of them together do. And so a lot of exciting research is being done right now. And what we're finding is there's a lot of different indications. As you know, CBD and CBG, well, CBD anyway, is available everywhere. Every vape shop, every store, every Amazon website, everything. And so those are very available. And you got to be careful what you get because some of them are just really oil. And as we know, oil and water don't mix. And because of that, what we find is the results are minimal, or it takes a long time to have effect. Whereas with this product we're using from Zalise, there's almost a 90% bioavailability, which means that the drug is doing its action on the body quickly and it lasts for a long time. And that's why our patients are able to do 2 doses a day and pretty much get the relief they're seeking. So those are good things. The combination of CBD and CBG is only found with Zalise, to my knowledge. I don't think anybody else has made this isolate that Zalise came up with, the CBG. Again, CBG is a very important part of the cannabinoid picture and the endocannabinoidal system, and so the combination of them is better than one alone. So our patients that are coming in are largely taking the CBD during the day and the CBG during the nighttime, and that's working well for those conditions we've talked about. Thank you.